Hello, my name is Anand Mantravadi. I'm an assistant professor at Jefferson Medical College and a member of the glaucoma service here at Wills Eye Hospital. I'm here to talk a little bit about the different classes of medicines that are available for treatment for glaucoma. As many people know, we try to modify intraocular pressure to lower the rates of glaucoma progression and the rate at which the optic nerve can sustain damage. And the key to doing that is by lowering the intraocular pressure. We have available to us many different classes of topical medicines that have been shown to be very effective in managing glaucoma. The classes of medicines can sometimes be confusing, but can be broken down into a few different categories in terms of how they work. If we think about the eye like a sink, and there is a muscle that makes fluid and drains that drain it, there are some medicines that work on telling the eye to make less fluid. There are also other medicines that work on telling the eye to drain more out of it. One of the biggest classes of medicines that tell the eye to drain more out of it is called the prostaglandin class. This was introduced in the 90s and has been a real boon for lowering intraocular pressure with once-a-day dosing with very good tolerability. Another class of increasing fluid getting out of the eye is an older medicine called pilocarpine that tends to make the pupil small and put the peripheral structures on stretch and get the fluid out of the eye. The other way to lower pressure inside the eye is by telling the eye to make less fluid. There are several different classes of medicines that do that. One such class is called the beta blocker class, and these are medicines that have been very effective at lowering eye pressure by reducing the amount of aqueous humor that's formed inside the eye. These can be very well tolerated, have minimal daily dosing regimens. However, they do need to be used in conjunction with your primary care doctor or under the careful supervision of an ophthalmic professional who can warn you on some of the side effects that may occur. Another class of medicines are called carbonic anhydrase inhibitors. Similar to the beta blockers, these also tell the eye to make less fluid within them. Very well tolerated and sometimes require 2 to 3 times a day daily dosing. A third class of medicines include the alpha agonist class, and these classes of medicines are used 2 to 3 times a day, and they tell the eye to also make less fluid. We are at a watershed moment in medical therapy for glaucoma. There are constantly newer molecules and newer products that are on the horizon, and indeed in the next several years there might be some additional classes of medicines that might work by different mechanisms as well. One of the big challenges with medical therapy for glaucoma is remembering to do them and doing them daily. In a condition that doesn't offer a reminder of its presence, it is a very challenging thing to incorporate as a part of your life. One of the ways to help enhance that is by combining different medicines in the same bottle. If one can get 2 different medicines with greater efficacy, but with the same amount of dosing regimen as, say, for example, 1 drop, then perhaps it lends itself to greater adherence with medical therapy with glaucoma. And indeed, we have several classes of medicines that might combine 1 or 2 different of the available classes of medicines for your glaucoma intraocular pressure control. Thank you very much.